This program contains actual surgical procedures. Viewer discretion is advised. The Long Island Plastic Surgical Group is the largest practice of its kind in the U.S., comprising 12 surgeons specializing in every facet of plastic surgery, as well as running the country's leading plastic surgery teaching residency. The group has been providing care to the people of the New York area and beyond since 1948, and now sees around 1,000 patients each week through trauma and burns work at nearby Nassau University Medical Center, the groundbreaking cleft lip and palate group, to more conventional cosmetic work. Over the years, the group's offices in Garden City, New York have been the scene of some amazing human stories. For the first time, our cameras have been allowed to follow the triumphs and transformations, all taking place an hour from the heart of Manhattan. Danielle Haug's nose is hideous. At least that's what she thinks.
My nose looks fat and big. Now that I look at this picture, and it's a close-up, and it's just showing everything that I hate about my nose. I think that this picture 2 years ago, even though I've been complaining about it for 13 years, I think 2 years ago this picture really was like the defining moment that I was like, I'm really going to pressure my parents when I turn 25 to really give this to me as my birthday present. And I did. For a year straight, I didn't stop telling them that for my birthday I wanted a nose job.
Started when you were about 12, so a good 13 years or so.
Wow, yeah. That's a long time ago.
I know.
That's a long time of listening to me.
You've always had a thing about your nose.
Her nose, to me, fits her face, and I think it...
Even in that picture?
Yes, even in that.
Check that one out.
Danielle, everybody's got their own nose, and you have your own nose, and I think
Dr.
you look
Douglas
beautiful.
is going to give me a great
He's a doctor,
nose.
and I'm not, and I think your nose looks perfect the way it is.
Thank you. Dr. Douglas said what they're going to do is they're going to make an incision right here, and they're going to lift the skin up.
Yeah.
And then they have a good view of my bone structure, and they're going to pretty much break the bone and chisel it down so that it's not as wide.
So will you still have that bump over there or not?
Right here?
Yeah.
No. They're going to shave it down.
Gone?
Yes.
I like your bump.
School teacher Danielle and her fiancé Frank have been together for 2 years.
I would hope to get married next July or August in the summer because that's my vacation from work.
And it's their forthcoming wedding that's prompted Danielle to seek surgery.
My goal for the future is to have a beautiful wedding picture where I will have a perfect little nose, and that won't be the first thing that sticks out in the picture to me. Look at that. I cannot wait until that is gone. Do you see how wide it is?
It's not wide at all.
Do you see how wide it is? Come on.
I see what you're talking about, but I see beauty.
Thank you, but it takes off half my face.
Oh, it'll be
Be a
gone.
quarter of
It'll be
size.
gone in 3 days.
I'm at the Long Island Plastic Surgical Group to see Dr. Douglas for my pre-op, where I hope that he will explain the final pieces of the surgery, which will be taking place a week from tomorrow.
Danielle?
Dr. Barry Douglas is another of the 12 surgeons working at the Long Island Plastic Surgical Group.
And then it'll go in like that
We're
a
going to
little
try
bit
to
more.
contour it without giving it like a pinched appearance, which we don't want. We want it to look appropriate and balanced. Particularly when we address your main concern, which is up here, where in photographs you say that this looks particularly wide, and on a profile view you notice your gentle convexity, which we call the dorsal hump.
Get a good one?
That's a beautiful one. Best photographs ever.
Dr. Douglas doesn't just rely on digital photography. He often sketches out for patients how they'll look post-surgery. Danielle leaves feeling confident about the surgery, but even bigger changes were about to happen in her life. It's Operation Day for Danielle as she finally gets the new nose she's been talking about since she was 12. Fiancé Frank and Mom Noreen are worried.
the truth today is very different now that it's here, and it's my daughter.
Danielle has serious pre-operation nerves, too.
She is a little bit nervous. You know, she's a young girl, and I think she's a little bit concerned about the pain afterwards, but we've reassured her that with all the medication we're going to give her, she'll be fine.
It's upsetting to watch her be upset and nervous.
Just sit down. I'm just going to make a couple little markings. Scoot a little towards with you. Just think nice thoughts. Nasal bone cuts.
It's hard because you get anxious and the time seems to really drag on.
We completed the rhinoplasty, and I think we accomplished our goals. We narrowed the tip, gave it some more definition, reduced the dorsum, and narrowed the bony pyramid to bring all the anatomy into a new harmony. And I hope she's happy.
As Danielle awoke, her new nose wasn't the only big change about to occur in her life.
I'm back here at the Long Island Plastic Surgical Center 6 days after my surgery to have the unveiling of my new nose, which I am extremely excited for.
Danielle wanted a new nose in time for her wedding to fiancé Frank.
Hello, Mom.
Hello, Dr.
How are you? Okay.
So before you do it,
Yes.
underneath is gonna be what? Still swollen?
There's going to be some swelling there.
Okay.
It is going to...
Black and blue?
the nose itself really isn't black and blue. The bruising is what you see is what you got, which is fairly minimal. I'm impressed. So whether that is a testimony to the way you bruise or the fact that that Sinek actually works, who cares?
Yep. It's feeling weird.
Yeah, it does feel weird. Tip that's just lifting it up gently.
Why are you saying wow?
Cute
What do you
little thing.
think? What?
What's more important is what you think.
You're scaring me, Mom. That's different.
Yeah, you don't think so?
No, it is.
It's a nice, beautiful line and have them go right there.
Yeah. Wow. I think you did an awesome job. I just hated my nose before. Now it's nice.
Those are tears of happiness. See, it's everything you wanted it to be, right?
You did a really good job. Frank will be very happy because I'm so happy. And I think he'll realize now that I had a big nose.
But there's a bigger surprise for Frank. Just over a week after the operation and a couple of days after the unveiling of her new nose, Danielle ends their relationship. The wedding plans are off. A month after her operation, and Danielle explains all to best friend Joanne.
I know I meant a lot to you.
New nose, new life.
New life. Hold on, let's make that toast before we get onto that topic.
Well, you know, things with Frank didn't really work out, so...
But there's a reason why they didn't work out.
Yeah, and it's for the best, but I feel like, although it's difficult no matter what time in my life it is, I think that me having a little more confidence in myself, although it's not noticeable to the public, really helps me get through it.
As the night wears on, Danielle reveals that it was whilst recuperating from her surgery that she had time to think about her relationship with Frank.
I was alone for that week, and I had a lot of time to think about it. And, you know, not only did I want the surgery for 12 years, but, you know, this was somebody that I considered spending the rest of my life with, and I had that alone time for that week to really sit down and be with my thoughts for once. And it really ended up not only benefiting me physically, but emotionally, mentally, and it just worked out for me.
Danielle opens up to Joanne about her new single life.
I did everything possible in this last month that was best for me. I got my nose done. I got out of a relationship. You know, I did everything possible. So what can I be sad about? Absolutely nothing.
Do you feel like you're getting any more attention now after the surgery, or?
I think from like strangers, I don't think it's, you know, like, oh, she has a great nose and they're giving her attention. I think it's my confidence has gone up, and so like I just feel like maybe like I hold my head a little higher, and I'm not hiding myself as much as I would have prior to the surgery.
Right.
It's 2 years that I've been out of the scene. First time, I'm 100% confident, you know, like I know who I am, and I'm having fun. Take a picture.
She may have lost her fiancé, but Danielle has gained a new confidence, even in front of the camera.